Hey guys, this is Dr. John Jazeri coming to you from San Clemente, California. And in today's video, we're going to be discussing the topic of holistic dentistry. Now, there's a lot of different terms for holistic dentistry: biocompatible dentistry, biological dentistry, biomimetic dentistry, natural dentistry, organic dentistry, a whole bunch of names. But the whole concept of holistic dentistry is it's the safest, least toxic, more focused on the whole body brand of dentistry, which is pretty much out there. Okay, so I'm going to be going over holistic dentistry, explaining to you pretty much what it is and the key ingredients, the 5 things that I think are the essential parts of holistic dentistry. Now, I'm going to make a disclaimer before I get into this, that holistic dentistry is really not a recognized branch of dentistry, something that's kind of out there. There's really no proof if holistic dentistry is better than traditional dentistry. It's kind of like the electrical vehicle versus gas vehicle debate, where some people say electrical is just the way to go, and other people are like, well, make an electrical vehicle and the battery causes a lot of damage to the environment. So which one's better? Yeah, nobody really knows. Same concept with here. So it is something that's out there. I'm going to go ahead and kind of discuss and tell you exactly what you need to know about holistic dentistry if that's something you're really into, and explain to you a couple real important aspects of holistic dentistry, and then you can make a decision if that's something that's for you, or if not, you've at least learned some useful information. So there are 5 things that most holistic dentists kind of focus on. The first and most important one is to avoid amalgam and mercury. So having a mercury-free mouth. That's the first thing that holistic dentists, and the most important one. The second one is to minimize the use of metals inside of your mouth, whether it's metals in braces, dentures, or particularly in porcelain fused to metal crowns. You want to try to use as little metal as possible inside of your mouth. The third one is to minimize the usages of root canals. So if you can try to put crowns and fillings and save the tooth, go that route. If a tooth is infected, take it out and put an implant, or just take it out in place of a root canal should be a last result. So that's the third ingredient of the holistic dentistry concept. The next one is to use biocompatible materials. So try to always go with the most organic and biologically compatible, least toxic material, whether it's something you use at the dentist or whether it's something that's prescribed to be used at your house for oral hygiene and whatnot. And then finally, the last one is to focus on the overall well-being of the body in terms of nutrients and well-being and diet and absorbing all the different ingredients, because the mouth and the body are connected together. They kind of work as a whole, and you want to kind of have both of those functioning at their optimal levels in order to have the best overall health and well-being. Okay, so those are the 5 things we're going to be discussing, guys. We're going to get to that in a second, but if you are looking for a holistic dentist or any other kind of dentist and you currently don't have one and you're searching for one, go to the website even28.com. That's EVEN, the number 2, the number 8.com, like the 28 teeth in your mouth. Guys, you can search based on your zip code, your city, go through browse through profiles of dentists to see what each one does, what services they offer. If they offer holistic dentistry, that's one of the services that's actually listed on the website. And when you find a dentist that you like, you can schedule your appointment conveniently online, all for free from the website even28.com. So go there, find your dentist, get that mouth fixed. I'll see you guys there. So the first concept, and probably the most important concept of holistic dentistry, is to avoid the use of mercury, which is found in silver fillings. So you want to go with white fillings over silver fillings. That's the cornerstone of holistic dentistry. No amalgams. Now, amalgams were the first kind of fillings that came out many, many decades ago, and they work extremely well. I mean, they restore your teeth, they keep them from breaking. Amalgam fillings almost never fail. They can easily last a lifetime. I've seen them where they're placed on teenagers and the patient is 70, 80 years old, and this amalgam filling is still in their mouth. So, however, having said that, amalgam does have mercury in it, and mercury is a known toxin. So the question becomes, is it safe to have mercury in your mouth or not? Now, there are millions of people, in fact, billions of people who have mercury in their mouth, because outside of like the more privileged countries, and if you go to third world countries, it's really, I either pull your tooth or I stick a silver filling. White fillings aren't really even prevalent out there. So in that situation, of course, you're better off with a silver filling than just letting the tooth get infected and keep pulling one after another, which does happen in some countries, unfortunately. But having said that, the white filling, the composite fillings, are kind of the newer fillings, and they are a little bit safer because of the lack of the mercury. Now, there's no scientific evidence if the mercury content inside of the silver filling, right? So if this being your tooth, these would be maybe like what silver fillings would look like on my model. You can basically tell when you look at them, they're silverish, blackish. There's no evidence that silver fillings actually cause harm to the body because the mercury is contained inside of the filling itself. Of course, if you go and ingest mercury, that's not good for you. So the risk of silver fillings is when you're placing them in and when you're taking them out. Those are the times where you don't want to ingest the mercury. But there's no, concrete evidence whether having silver fillings in your mouth can affect your health or not. But holistic dentistry says you should not have them. So if you want to go the holistic dentistry route, you have to either A, avoid getting silver fillings, so opt for the white fillings. There's usually a little bit of extra charge, but most dentists nowadays offer white fillings. And then B, if you have silver fillings in your mouth, you should remove them. Now, this is where it gets a little bit tricky because removing silver fillings isn't as easy as just going to the dentist for one day and removing them. If you have one or two silver fillings, small ones, it could be a simple, easy process that might not take a lot of time or cost a lot of money. But if you have a mouth full of amalgam fillings, you have 6, 7, 8 fillings that are all silver fillings from childhood and a long time ago, taking those out is going to be quite a bit of work. First of all, when you take out silver fillings, your tooth can end up being sensitive, which may be temporary or permanent, okay? With bigger silver fillings, the smaller ones, you can just replace them with white fillings. But when you take out a bigger, gigantic silver filling, usually a white filling is not going to cut it. Then you have to put an onlay or a crown on it. And that can add to the complication and cost a lot of money. Sometimes when you take out a really big silver filling, the tooth starts becoming painful, and that's an irreversible process, and now you have an infection. So that can also happen. You end up losing one or more tooth in the process of converting your silver fillings into white fillings. So there's a lot of things that goes into that. If you are set on having your silver fillings replaced, you have to find a really good dentist and be ready to invest quite a bit of time and money into getting those silver fillings replaced. And that's basically how it's done. And then, of course, you want to go to somewhere where they're doing safe mercury removal, because when they remove the mercury, you can ingest it. So there's ways that dentists can put like rubber dams, or they have these things to get rid of the fumes so you're not ingesting them. So you want to make sure you pay attention to those things. Find a holistic dentist or somebody who has experience with holistic dentistry to do that. And that's how you go about replacing your silver fillings with white fillings. But again, only do it if you're dead set on doing it and you really think your health is being severely affected by it. Because like I said, there's millions and billions of people with silver fillings and they're doing fine. They're getting through every day and whatnot. But holistic dentistry just does not like silver fillings and it insists on avoiding them or having them replaced. So that's the first concept of holistic dentistry, is no mercury fillings, no silver fillings. Okay guys, the second concept of holistic dentistry is to minimize the use of metals inside of the mouth. So a lot of things that dentists do have metals in them because metal is just very sturdy and very strong. So when we do a lot of dental procedures, we use metal. What are these things? One of them, for example, is dentures. When you're making partial dentures, we could make them with metal. Well, holistic dentistry says don't do that, make them flexible partials instead, which has no metals in them, okay? That's a simple one. Or for example, braces. If you're getting braces done, dentist is going to put these little brackets on your teeth, right? You're all familiar with those if you've had braces done. Well, holistic dentistry recommends putting ceramic brackets on your teeth. Now, those are very simple concepts because most people who do holistic dentistry don't wear partial dentures, and braces are usually done when you're younger, so it's really not that big a deal, and it's only on your mouth for a short amount of time. But this critical thing becomes on crowns. What holistic dentistry says is try not to put metals inside of your crowns, okay? So originally crowns were made from gold alloys, which obviously had metals in them. Nowadays, there's two kinds of crowns. One is the porcelain fused to metal crown, which has porcelain on the outside, but metal on the inside, huh? You see the metal right there? That's a combination of different metals: silver, palladium, nickel, chromium, and cobalt, and whatnot. They recommend that you go with ceramic crowns, which is made from ceramic and zirconium oxide, and it has no metal in it, okay? So that's one of the things that holistic dentistry emphasizes, is to try to avoid using metal-based crowns, okay? And that's actually an easy one, and that's one that I'm kind of myself and most dentists are in agreement with, because metal crowns, forget the holistic aspect, the ceramic crowns are just better crowns. They don't break as easily, the porcelain doesn't separate from the metal like the PFM crowns do. It's easier to clean them, better hygiene, they look better, they don't have kind of a bluish, fake-looking tint to them. So especially as the crown ages, they just age better too, and they just look more natural. But in terms of a holistic aspect, You want to try to minimize the use of metals in your mouth, and ceramic crowns don't have as much metals the same way that traditional porcelain fused to metal crowns do. So with holistic dentists, you always want to go with ceramic crowns, ceramic inlays, onlays, as opposed to porcelain fused to metal crowns. Okay, now what do you do if you have a bunch of porcelain fused metal crowns in your mouth? Again, that's kind of like the previous conversation that we have. It's not very easy replacing crowns. It's a lot of work, it's a lot of money. Things can go wrong. You may start removing crowns and they can break and become a tooth that you're gonna lose. So you're gonna do this very cautiously. I wouldn't recommend just going out ripping out 10 crowns out of your mouth just because you're worried about the metal. You don't want to do that. But, you know, if they're deteriorating over time and you're trying to replace them, then yeah, replace them with ceramic crowns, which is the better crown, and it has no metals. And if you're planning on getting crowns, you know, talk to your dentist, tell them, hey, I want the more holistic, the ceramic option, and your dentist will be glad to charge you $300-400 extra bucks, whatever it is their fee is, to upgrade your crowns from the traditional porcelain fused metals to the ceramic crowns. But again, that's a better option. So I'm actually a fan of that. I do very few porcelain fused to metal crowns, and not necessarily for the holistic aspect because of the difference in the quality. But if you're worried about having metals in your mouth, then yeah, you definitely want to try to avoid any kind of dental prosthesis that has metals in them. So that's the second concept, is try to minimize the use of metals inside of your mouth. Okay guys, the third concept of holistic dentistry, number 3, is to minimize the use of root canals. Now, what are root canals? I'm gonna kind of give you a brief description, although if you're interested in learning more about root canals, check out my other video. But a root canal is basically this thing right here. So where we remove the nerve portion and replace it with a synthetic filling, gutta percha, in order to get rid of the infection. Okay, root canals are very popular. Millions of people have root canals in their mouth. Well, unfortunately, holistic dentistry is not a fan of root canals. They say when you do a root canal, the infection can remain in the tooth. There's no way of knowing if the infection is eliminated, so try not to do root canals. Well, what does that mean? That means if you have a tooth that's a little bit sensitive or hurting you, try to put a filling or a ceramic crown, as we previously discussed on it, to see if that resolves the problem. But once a tooth gets infected and there's an active infection, which shows on the x-ray, or you're having severe pain on it, well, at that point, obviously a filling or crown is not gonna do it. So you have to do a root canal. Well, the holistic approach is to not do a root canal. You take the tooth out, and then you either go toothless or you put an implant in its place. Now, this is very controversial because almost every single dentist does root canals, and they believe in root canals, and root canals work. There's nothing wrong with root canals. Everybody's got a couple root canals in their mouth, but holistic dentistry doesn't like root canals, so they recommend to try to avoid root canals at all costs. What's my personal opinion? I mean, you know, I do root canals. I do a lot more implants than root canals, but when I have to do root canals, I do it. And you know, a lot of people have root canals in their mouth. I mean, what are you gonna do? Just rip out 5 of your root canal teeth? It's not something people can do. You're obviously better off with those teeth than no teeth, because if you have 5-6 teeth all of a sudden taken out of your mouth, how are you gonna function? It's gonna cause TMJ pain, teeth movement. You're gonna have more problems with those teeth missing than with a few root canals. But there is an issue with root canals becoming infected and becoming neglected, and that's where you wanna pay attention. I'll give you a prime example of this. This patient presented with a couple of root canals. Okay, so if you notice, this root canal right here is fantastic. This root canal here is fantastic. This root canal here is not so fantastic. It's abscess infected. That's a train wreck. And this root canal here is, you know, it's kind of a little root tip. It's in there. It's not super infected, but it should come out of the mouth. But this one in particular, right? This is where the problem. So what happens is with the root canals, when you do a root canal, they remove the nerve, they remove the infection. Your tooth is void of any infection and pain. Great, fantastic. You get to keep your tooth, you don't have pain, and you only have to go 1 or 2 visits for a root canal. So it's an easy way of saving teeth, and it's a lot less expensive than dental implants. But what happens, and the risk is, if you have a root canal tooth that becomes infected, because with this root canal tooth, I mean, this tooth's been infected for years with an abscess that drains right into the bloodstream and goes to the rest of your body. So when you have an infected root canal, a root canal reinfection essentially, which happens, that's very dangerous. That's something that kind of drains infection into your body. And unfortunately, because the root canal has been originally done, you don't actually have pain to tell you, hey, I'm an infected tooth, take me out. See, if you have an infection in your finger, in your ears, in your nose, you know you're going to feel pain, you're going to see pus, you'll know you're infected. But when a root canal tooth gets infected, there is usually no symptoms until very well down, the line, like maybe months or even years down the line. So if you have root canal in your teeth, my suggestion is to go to your dentist regularly so that they can make sure your root canals are doing well and they're not reinfected, okay? And when a root canal does get reinfected, yeah, then you should take it out and consider going toothless or putting a dental implant. But I mean, with the holistic dentistry concept, they just don't like root canals and they say you have to take them out. So what happens when you have a root canal tooth or a tooth that needs a root canal infection? Well, the recommendation is A, take the tooth out and put nothing there, or B, go for dental implants. Now, of course, if you're super holistic, the problem at that point becomes, what do you do with the implants? I mean, most implants are made from titanium alloy, which is a metal. So that means you have to go for ceramic implants, right? This is a ceramic implant, which is zirconia based. And unfortunately, those implants are $5,000 to $10,000 each, very expensive. So it's not a very simple solution, and it's not a very cheap solution if you want to just take your teeth out and not do root canals. It's something you really have to be 100% committed to in order to go that route. But having said that, at the end of the day, holistic dentistry recommends no root canals. And I've had patients that go to a holistic dentist and they come back with 2-3 teeth missing, and I'm scratching my head, why did you take out these root canals? But that's what holistic dentistry indicates. So if you are a holistic dentist, a holistic patient, I apologize, you want to make sure you're brushing and cleaning your teeth so they don't get infected, because if they get infected, you just have to take them out because you can't do that root canal stuff. Okay, so that's the third concept of holistic dentistry, is minimize the usage of root canals inside of your mouth. The fourth concept of holistic dentistry is to use biocompatible material. This one is actually very tricky because honestly, most stuff that dentists use are not very biocompatible and very natural, to be honest with you. I mean, the glue we use, the acid we use to roughen up teeth, the cements we use for crowns to stick to teeth, those things are all acidic based and they're a little bit toxic, okay? The good news is we use them in very small increments and for very short amounts of time. It's not like we're just putting it inside of your mouth, but we got to use what we got to use to make our, dentistry work. I mean, if you put the crown in there and you have a super holistic cement, it's just not going to hold up. I have to buy the 3M cement with some acid in it that gets the trick done. Okay, so in terms of actual stuff that we use for more complex dentistry, the holistic thing really just quite hasn't worked out because there's just not enough of a market, and the stuff we use are the chemicals that get the trick done. Okay, but there are things where the dentist can actually become a little bit more holistic. Like, for example, the toothpaste that you use. Well, holistic dentistry recommends minimizing the use of fluoride. So a lot of dentists who are focused on holistic dentistry go with a mouthwash that doesn't have fluoride in it, like the Tums of Maine or all the other naturopathic toothpaste. Same thing with the mouthwashes, naturopathic mouthwashes. So whereas your traditional dentist might give you like a chlorhexidine prescription for your gums, the naturopath dentist, the holistic dentist, would recommend peroxide with baking soda solution, elixir that you kind of create and you rinse your mouth with them. And listen, don't get me wrong, they're both pretty good. I mean, am I a fan of fluoride? Honestly, the fluoride you use in toothpaste, it's not significant enough to cause damage. Of course, fluoride is a known toxin in high doses. So if a kid goes and digests a whole tube of fluoride, then yeah, they're gonna have a problem. But the little fluoride you put on your tooth and you spit it out, it doesn't really get ingested. So I don't really see a problem, but the super holistic patients don't want any fluoride anywhere close to their mouth, Again, this one's a tricky one because like I said, most of the stuff dentists use, we just have to use it because it gets the work done. They're not designed to be the safest, most organic material. So you want to try to just keep really good hygiene and take care of your teeth so you don't end up needing all these complex dentistry. But if you do, if you go to a naturopathic, holistic dentist, they're going to try to use the material that is the safest and least damaging to the body. But again, even that comes with an asterisk marks because frankly, I mean, all the cements and all the bonding agents that we use, they're pretty much all the same, 2-3 brands that we buy. So there's really nothing that's super organic. But again, just try to minimize it whenever you can. Like I said, with the mouthwashes, with the toothpaste, maybe with the polish you get for your cleaning. That's where the organic dentist, the holistic dentist, kind of go out of their way to come up with stuff that makes it a little bit more natural and organic and a little bit easier on your body. So that's the fourth concept of holistic dentistry, is to use biocompatible material whenever the opportunity presents itself. Okay guys, the last concept of holistic dentistry is to focus on the overall well-being of the body. Because what happens is the mouth and the body, the rest of your body, everything is kind of connected together. They all run on the same circuit. So if you have a damaged tooth, that can affect everything, right? Because that can affect the nerves and the bloodstream, which is connected to the rest of your body. So with holistic dentistry, having a healthy mouth and a healthy body are kind of intertwined and connected to one another. And that's what they believe in, okay? So this goes beyond really dentistry. This is stuff that you have to work with your physician or dietitian or whatever, a naturopath to help you out with those things. Because you know, having a balanced diet, getting the nutrients, the proteins, the vitamins that you need, and not just getting them inside of your system, making sure they're getting absorbed into your body and used the way they're supposed to. Improving on your diet, your intake, having, you know, balanced nutrients and pH. All those things that help you have a healthier lifestyle, okay? Reducing your alcohol and, you know, nicotine intake. Those things all end up having a healthier overall body and a healthier system, which can also affect your mouth. And to an extent, this is all true because, you know, patients who have dry mouth because of severe medical issues, they always have messed up teeth. And healthier people generally have healthier mouth and vice versa, okay? So the last concept of holistic dentistry is just focusing on having a healthier lifestyle, healthier body, which is also going to result in having healthier teeth and a healthier set of mouth, okay? So that's the fifth concept of holistic dentistry, which again, because it's more medical related, I don't want to get into it because I'm a dentist, not a physician. All right, guys, but yeah, having a healthy body, you want to work with your physician to make sure you're, you know, doing all those things. And when you do that, your mouth is going to be healthier, more saliva, less plaque buildup, and you're going to experience better oral hygiene as a result. All right, guys, it is time for me to share my thoughts on holistic dentistry, biological, biocompatible, whatever you want to call it. Holistic dentistry is not for everybody, for sure, okay? Maybe 1 or 2% of the population ends up wanting to do holistic dentistry, which is why maybe 1 to 2% of dentists are holistic dentists. If you actually are committed to having holistic dentistry, you're probably going to have to drive 2 hours because there's not a lot of holistic dentists. It's not a board recognized specialty. It is a lot of headaches being a holistic dentist if you're like fully uncommitted to it. So it's just not easy finding dentists that do holistic dentistry. Do I do holistic dentistry? I mean, if somebody wants it, I offer it, but I would not consider myself a full-time holistic dentistry because I do stuff that gets the job done. You know, that's my primary goal. But again, if somebody says, hey, doctor, you know, I want holistic dentistry, don't use fluoride, don't use porcelain fused to metal crowns, you know, I will go out of my way to accommodate their needs. Not a problem, because I'm familiar with what the practice entails. Having said that, the problem with holistic dentistry is, first of all, there's no like concrete evidence supporting that it's the right way to do it, okay? And again, the majority of people just get traditional dentistry, silver fillings, porcelain fused to metal crowns and whatnot. Okay, and tons of root canals in your mouth. So, you know, it's really up to you to decide if your mouth and what you have in your mouth is affecting your health. And if that's enough for you to make a commitment of spending maybe a year or two replacing your resistance, then I'll work with what's more holistic and spending thousands of dollars on it, you know. Insurances usually don't help with holistic dentistry treatments because, first of all, holistic dentists have really high fees. Second of all, you know, the insurance doesn't care if you're not happy with your silver filling or porcelain fused to metal crown. If it works and it looks good on an x-ray, that's it. So if you want to replace them because you're worried that they're causing you, you know, leukemia and headaches and psychological, psychiatric problems, I don't know, whatever you think your amalgam fillings and porcelain fused metal crowns are doing. If you really believe in that, it's kind of your responsibility to pay for replacing them. Insurances don't cover replacement of functional prostheses that are getting the trick done. So you have to pay for them. And usually when people want to get a lot of work done in terms of like replacing the silver fillings and crowns and root canals, tens of thousands of dollars is what you end up spending at a holistic dentist. So it's not easy, it's not cheap, and again, like I said, it's just really not for everybody. So unless you have like some really autoimmune conditions or you have some really bad chronic medical issue which you are, you know, just kind of made up your mind that it has some kind of urgent to do with your mouth, like I said, it's just really not for everybody because it is just a big financial and time commitment. And it just takes a long time to do all these works. Okay, but anyways, if you are fully confident that, this is something you want to do, then yeah, you gotta do some research, find a great holistic dentist, start building a rapport with them and a relationship, and little by little start fixing whatever you think is causing problems. I never recommend, if you have a bunch of silver fillings that, for example, you want to take out and replace with white fillings, let's say you have 8 of them, first of all, a situation like that, you probably will be able to replace 3-4 of them with a white filling, 2-3 of them might need onlays and crowns and whatnot. So in terms of the work itself, it's a lot of work and you have to do it gradually because when you remove a filling or a crown, there could always be issues. You can have sensitivity, the tooth can break. So you always want to do it incrementally over time. This way you can make sure everything's going as expected. You're kind of getting the results that you want, and you can also have time to pay for the work, right? So you never want to kind of rush through it. Like I said, this is a big commitment. Usually people who do these things spend, like I said, a year or two getting their mouth to become more in tune and more holistic, okay? But yeah, that's pretty much how this all works, guys. I was kind of excited about getting this video out there because there's just not a lot of stuff on holistic dentistry because it's a very small branch of dentistry. It's not really acknowledged by the American Dental Association. And because it's just so expensive and such a headache, just not a lot of dentists do it. But for those of you who are absolutely committed to wanting to do it, then yeah, go ahead and find one and just be ready to spend that time and money, and also even driving to the good holistic dentist because, like I said, there's just not a lot of them out there. And hopefully that'll help you feel a little bit better and give you the results that you want. Okay, guys, so that's pretty much what I have to share with you guys regarding holistic dentistry. If you got any questions for me, which I'm sure a lot of you do, please put them in the comments. I'll be glad to answer them. And be sure to check out my other videos to learn more about all the other topics that I talked about here. And I hope you enjoyed this video. I'll see you guys next time.